So something that I also really like to talk about that's close to my heart is talking about these relationships with families. I can't give this presentation without talking to you about the importance of having a good relationship with these families that you're going to be working with, whether it is the biological family or the foster family. That whole unit together is a family. They may have a main caregiver being that foster mom, and then that child goes and has visits with that biological family, maybe once every other week. It doesn't matter. It's still the same. That whole family is a unit, and we should be working together with the whole family. So a lot of the presentations that I give, I had to put this in there just to talk a little bit about it, because I get a lot of questions of why would a mother do this? I can't imagine. I'm a mom. Why would a mother do this? Why would she use drugs during her pregnancy? I can't imagine the abuse and the comments that are put online when they post those videos. The comments are just, they're so sad about people prosecuting that mother. And a lot of you will go away thinking the same thing, because we'll talk about the symptoms that these children have. But I have to back up and tell you a backstory about these women. These women, about 75% of them have gone through major trauma in their life. Major trauma, meaning that they were molested as they grew up. They grew up in really poor families, and they weren't taken care of. And they lived their whole life like that. Or their mother was an addict, and she used right in front of them. You have to remember that everyone has a story. You have to back up and think, why did she do this? There is no woman I can imagine that says, I'm going to pick up a needle and I'm going to shoot myself up because this is what I want to do and it feels so good and I don't care about my child. That's not what happens. They feel guilty. They hate themselves for this. And we will talk about that. So this video kind of gives you a little glimpse into what they see from their side of the story.
All of us, cope with our problems differently. Some of us can deal with them great. Some of us, we have other issues and other ways of coping with it. Because I was going through problems and I had started talking to a friend, and from there it led on to the drugs. When I found out I was pregnant, I was already addicted. I was already an addict. I was scared. I was really scared. What's gonna happen if you come and ask for help and, you say, hey, I have a problem, I'm a heroin addict. My worry it wasn't myself. My worry was my kids. Because right away, the first thing that pops in your head is CPS. I didn't know who to ask for help, who to turn to. I had first asked my family. So, I was hoping that they would help me out the first time. They actually all stopped talking to me because of the whole issue.
The amount of stress that these mommies must be under every single day. When a mom comes in and they are with substance abuse, there's a stigma, there's a prejudice, there's a bias, and it's very, very real to them. I think they don't feel empowered. I think they feel embarrassed that they have this problem.
Many of the women that I interviewed who were substance users came from very poor backgrounds, the issues of mental health that were not addressed. A lot of the women that I spoke with also had a history of violence in their past.
I started using when I was 12 years old. My mom was an alcoholic. My father walked out on her when I was like 2 weeks old. Her boyfriends molested me and did things with me, and so I just turned to drugs. When I was about 30, I started doing methadone, but then I'd always relapse and go back to heroin. And I guess it was just because I really wasn't ready to quit. I wanted to die. I was like, oh no, I can't be pregnant. I can't be pregnant. No, I'm 38 years old. I can't be pregnant. With losing 3 other children to the Child Protective Services, they wanted to take Sadie's as well. I just was to the point that I was tired of being tired of being tired of being tired of being tired. I went and I talked to Miss B, and she's like, Dawn, maybe this is, you're enlightening.
What we try and focus with the mom is helping them understand that if she is doing everything that she needs to do to move forward in her recovery, then she's okay. She's going to be okay.
When I was 15 years old, I tried heroin for the first time because it was just on weekends. I said, oh no, I just go and party. I'm not hooked. I don't do anything. And, then I started selling drugs, and I had it all the time, so my addiction grew. I got pregnant at 16, and I didn't know what to do. When I was pregnant with her, I stopped using. After I had my daughter, about 5 months later, I started using again. When I found out I was pregnant with my son, I didn't want to get it to the doctor, because their attitude, not everybody, but those few doctors give all the doctors a bad look.
With the medical community, with the legal community, there is so much judgment and personal bias placed on women that use substances that are battling addiction. Specifically in the Latino community here in San Antonio, it is a huge issue. There is a significant amount of judgment.
Oh, okay, that one. Doctors and some people that don't have a lot of knowledge with the methadone, they look down on heroin addicts, and I'm telling them, I may be an addict, but I'm still a person. I'm still a human being. I had an experience, though, with one of the nurses, and it really bothered me because she called my son a drug baby. And I got mad, and I said, he's not a drug baby. His name is Alexander, because I feel like when there's kids that are sick out there that got the flu, they got pneumonia, they got a stomach virus, they're not labeled the pneumonia baby, the flu baby. He's a baby that's sick. He needs extra help, but he's a baby named Alexander. He's not no drug baby. I didn't know that there was this type of clinic. I always hear negative feedback about methadone, so I said, I ain't gonna get on that. Because I said, I'll just detox. No, you can't. The baby can die. And I didn't know. I said, no, I can do it. I can do it. And I've been through a lot. I couldn't do that. But it wasn't about me anymore. It was about him.
Women that are pregnant cannot just stop using heroin or prescription narcotics. That's not safe, because what can happen is they can go into premature labor. The baby is at risk. They are at risk. So what is considered best practice for them is to go on a medication-assisted treatment such as methadone. Those medications help that patient feel normal. It takes away the withdrawals, the cravings. You should not be able to tell that they are on a medication.
To fully understand the complexity of the issue, you have to understand the full spectrum. So it begins, early on for many of the women. They're very young, typically when they first are introduced to drugs. The women that I talked to were all introduced to drugs by a very trusted person, and they were really kind of naive when it started. And, I don't think that at the time when they were 13 or 14 and it was starting, they were looking down the road to, oh my goodness, someday I might have a baby that's exposed to opioids.
Oh, baby, I love you so much, honey.
I would cry a lot because I felt like I did that to him. Any mother would be scared for their child to go through the withdrawals because we don't like going through the withdrawals. It hurts us. Imagine how it hurts a newborn.
Say hi.
Neonatal abstinence syndrome occurs when an infant has been exposed to, primarily it's opioids, because it crosses the placenta and the baby's exposed to it while they're in the mom's uterus. Once the baby is born, then the baby goes through withdrawal much like an adult would go through. Being there as often as they can be, learning different ways to comfort their infant and be a part of their infant's life is really, really critical. We already have a situation where moms and babies are separated because of the infants, experiencing neonatal abstinence syndrome. What you really want to have happen is a good, strong attachment between mom and baby, and that can really affect the mother-infant relationship for years to come after that.
I went and saw her every day. I would just rock her, sing to her, pat her back, give her warm baths. She's a really good baby, though. As long as she was happy, I was happy.
With my son, I want to hug him, I want to kiss him, I want to cuddle with him. And at times he doesn't like that. No matter what I tried to do, he wouldn't calm down until I would swaddle him up and lay him aside, give him his pacifier. Once he was out of my arms, in his swing, he would calm down.
The most important part is making them powerful with information. So when they come to the NICU, they're fully prepared for what they might see, but they're also fully prepared to ask questions if something is different.
We didn't actually go home until she was like 9 months old. So we were in like school, we were in class together all the time. So many classes. I learned a lot in there. I learned coping skills, I learned parenting skills, I learned relapse prevention. I mean, there was NA groups, there was AA groups. They have all of those resources. That's where I found it at, was through them.
There's a lot of classes, the 13 classes that they need to go through, from childbirth to nutrition, to what it's going to be like when their baby withdraws. We have all kinds of experts from our hospital that comes and talks to them about what they need to know, how they need to prepare, and what they can expect. The work belongs to them. The hard work does belong to them, but we need to provide them the resources to help them succeed, and I think that's what this program does.
I've never came across a place that has so much to offer. It got me out of the guilt stage, just knowing that, yeah, he was there and he was sick, but that he was gonna get better and that one day he'll be out of there, So that's what helped me to get by and just stay strong. Once I accepted where I was in my life, I was able to move to the next step.
It's a very complex issue, substance use is, and it really takes kind of a multi-disciplinary approach to manage it.
Addiction is a very, very difficult disease to deal with. And really, it's having them understand that so that they can get those skills that they need to be able to deal with those difficult moments that prompt them to want to go back to that substance.
Don't put the baby through it. It's not the baby's fault. There's programs out there, there's help out there. You just have to want it. Miss B is like, Dawn, just do what you're doing and they won't take her. Just stay strong, stay in the program, learn your coping skills and everything will be okay. And I said, all right, and it worked. And it's still working for me today.
Don't be afraid to seek out that help. It's going to be a tough road. It's going to be a lot of work, but it's possible. People do it every day and are able to become successful, productive members of society. But more than anything else, for those that are parents, so that you can be there for your children.
I almost cried when I left the hospital. You grow feelings for the nurses there. They were with me through the whole journey. I love what they do in life. Working with babies like that, that's what I want to do now. I can relate to those mothers that are going through what I went through. So that's what I'm going to start doing now, is going back to school for that, to be a nurse like them.
Life is great. I have a job. We have a place to live. We got our own transportation. And I never thought I would have all that, to say that, well, we achieved it. On.
When I started, I had a prejudice and a pretty strong bias about these mommies, and I don't see it that way anymore. I see that these are women who are struggling with a problem, substance abuse, and they're pregnant and they need help.
We've had so many cases where Mom is doing what she needs to do, and eventually the case is closed.
One mom that I talked to said she never ever misses a NICU reunion. They go back every single year to visit that one particular nurse that was so meaningful to them.
I don't know what I would have done without it. I probably wouldn't have Sadie's. She's a good kid. I love her to death. I have a full-time job. I'm training to be a manager of my place where I'm working. It's actually pretty weird to have a normal life, but it's a good normal life, you know? Where being abstinent, I mean, I never thought that I could do it, but I did.
He's healthy, you know, he's awesome, he's great, you know, he has us running behind him now, you know, so I just, you know, that there is hope. The knowledge that I've gained and that I've learned, it made me realize that it saved my life. You know, I always thought, well, there's nowhere I can go, you know, and now I found a place that I can come to where I belong.
Can I see you talk to the monkeys, love?
You know, I knew one way or another I was, you know, things were gonna get better and I was gonna be able to bring him home, but I just really didn't know where to start. If I would have known then what I know now, I would have came a lot sooner.
Working with these families, recognize that these mothers are going to be feeling guilt. They're going to be feeling anxiety. That's something that if you're going into their home, understand that they are very aware. They understand that they are living in very bad environments sometimes. Understand that they are aware that their child has an NAS. They are aware that what they did caused their child to have NAS or substance exposure, and that when you're talking to them and saying, oh, when your baby has these tremors, you know, let me show you some different things to do, that they're in their mind thinking, I caused this, I caused these tremors, I'm so embarrassed right now, I have a lot of anxiety about this. They might start to cry. Those things are very normal because they feel it. Now, imagine if I was going in there and my face was, yeah, that baby's doing that. That baby's crying. Let me show you how to do it. And rolling your eyes is not very trauma-informed. And it's also not showing a lot of sympathy to that family. It's not showing that compassion that we have. And so using a non-judgmental attitude, coming in, they are very aware of their environment. They are very aware of things that are going on in their life. You don't have to point those things out to them, that they know that. And that guilt and anxiety will probably come up when they're talking about their goals. I knew a mother, actually the very first family that I visited since I joined the EI world, was a woman that I knew from Great Starts, which is the program that I was coming from Helen Ross McNabb. I knew that I was going to have to spend a little bit more time because I knew when I came in she wanted to update me on everything that's happened since I've seen her in the past 3 months. So she wanted to tell me about her child and how the permanency plan was going and how, you know, these great things, and that's so awesome. So we sat there and talked, and I'm so happy, and she talked a lot about anxiety and how overwhelming that is, because especially if you're getting a family that is getting that biological child back, how overwhelming that is, because they've only had just visits or they've had overnights, and all of a sudden they're here and they're excited, but they are very anxious about all of this. So we talked a lot about that too, and that's something that may come up when you are there, and that's something that, you know, we can try to move around and navigate them too. Like, hey, let's talk about some of the goals maybe surrounding that and go back to that, you know, routine-based, like, sounds like you're really anxious. What's something that we can do that can make you feel less anxious when we're doing a diaper change? So that sort of talk with them. Educate that family about resources. I went to a family last week who didn't even know what WIC was, and so I was like, okay, well, we need to move on back because I need to help you get this WIC form. I'm going to bring it next week. You're going to have it, so then that's something we don't have to worry about the GI issues for your child, because your baby's taking regular formula and that's not really appropriate for the GI issues that they're having. So know those resources. I know that we're given a lot of resources, and I'm going to give you some at the end, but use them. Use those resources. And help the family as a unit. So especially if that family is planning on having some visits with a biological family, or they're moving towards transitioning back home, know that that whole family is a unit. That child is bonded with a foster family probably, and that's probably really, really hard for that mother to get that child back and know that that baby calls the other family mama. That's traumatizing in itself, to have your child call somebody else mom or dad, and knowing that that was something that was because of the addiction that you had. So know that that whole family is a unit. This sheet is on out there, right? Everybody have one? This is a wonderful, wonderful, wonderful resource about NAS, like an NAS info sheet. This is something, I'm going to send you out the colored copy to your email, so you can have it and you can print it off, black and white or cut in color. But this is just a great little, this is called my NAS 101. Somebody who doesn't even know what NAS is, if you're getting a foster family like I did last week, that had no idea what NAS was and what these things are happening, and just kind of completely clueless, and they don't have time to get on Google. And if they did, oh my gosh, how many different things come up and how overwhelming that is, and mostly it's, prejudice. So this is factual. These are some information, facts that you can give them, and just sit and say, well, what parents can do if that child is, is being overstimulated. Well, you can reduce the stimuli and play soft music. This is a great little info sheet that I put in my back pocket when I get an NAS diagnosis, or when it comes up saying that that parent possibly had a drug exposure, the child had a drug exposure, then I make a copy of this, slide it into my folder when I go visit them, and then, if they happen to say, like, I'm not really sure about, why they do this, or I'm not really sure what NAS is, and we're going to have a great info sheet for you right here that can help you learn about a little more about NAS. So this is a great little sheet to have.